Now, how do we know when to treat the prostate cancer, when to operate and when not to operate? Of course, there's some over-treatment today because we don't have a great way to distinguish this. But as more and more genetic tests is coming in our life, we will be able to distinguish this and find out which prostate cancer is what we call a real pussycat or not really aggressive or indolent or slow-growing, and one is a real tiger and that is going to escape and is a very aggressive prostate cancer. Yes, something called Gleason score may give us some information, but is every Gleason 7 or every moderate prostate cancer the same? And the answer is not. Why is it that sometimes we operate on a Gleason 7 and they do really well, and another Gleason 7 may end up having recurrence or radiations? Well, a lot of answers could be in genetic components. And the recent study from UK, they looked at the genetic components of 250 men. This is what we're going to talk about today on Fox News. And out of these 250 men, they found out that if you look at 100 different genes, they all are diverse. They're not all the same. And not every person has similar genetic component. And that's when you're getting into the nuts and bolts of genetic mutations and genetic configuration of each patient. Something called precision medicine, meaning that two patients will come in with the same type of prostate cancer. One may need treatment and one is not going to need any treatment. And I think these genetic testings are going to really help us. This study comes from Cambridge in London, in UK, and the Cancer Institute over there, they're very excited about this. And I think what this is really going to pan out is that in the future, we're going to see that kind of deciding who should get biopsy or not. It's going to cut down on the unnecessary biopsies once we have the genetic components. Now, in our practice, in our center in Madison Avenue, and for anyone that has questions about prostate cancer or elevated PSA, you can call my office, 212-365-5000, and we have a lot of these genetic components. Some of the things that we use right now is something called 4K test. PSA, which stands for prostate-specific antigen, is a very non-specific test. Enlarged prostate, inflammation, prostate cancer can lead to an elevated PSA. But 4K test consists of 4 different types of PSAs. It has total PSA, free PSA, intact PSA, and something called HK2 that would make it a little more specific whether you have prostate cancer or not. We're using urine tests called PCA3, where after an exam, prostate exam, we will be able to shed some cells and find out if you have prostate cancer or not. And obviously, if you have prostate cancer, using genetic tests such as Oncotype DX, which consists of 12 different kind of genetic tests, or if you have a negative biopsy, looking at confirm MDX. These are all genetic tests that are looking to see if biopsy is correct or not, looking at the component of that biopsy and find out if it's accurate or not. And there's something called Prolaris is another test that will tell us how aggressive is your prostate cancer. So a lot of these genetic tests are coming into our practice, and I think this study coming from UK is significant, and in the future we're going to use a lot of these genetic tests.